Good evening, everyone. Myself, Preena Parmar, and I am here to share a few questions on anti-ulcer drugs. The first question is, which of the following is the most common adverse effect of omeprazole? The options are black stools, constipation, headache, osteoporosis. Now, Now let's have a look into this table of peptic ulcer. It has a few drugs and its adverse effects. First is sodium bicarbonate. It has a few adverse effects of bloating, belching, metabolic alkalosis, etc. The same adverse effects are of calcium carbonate, that is bloating, belching, metabolic alkalosis, and it also has hypercalcemia. Then comes magnesium hydroxide. Magnesium hydroxide here has osmotic diarrhea. However, on the other hand, we have aluminum hydroxide. It has the adverse effect of constipation. Next is histamine H2 receptor antagonist. It has a few drugs named cimetidine, ranitidine, etc. They have cimetidine here has the adverse effect of mild diarrhea, constipation, headache, myalgia, etc. And ranitidine has its main effect on CNS, causing confusion, hallucination, and excitement. Next is proton pump inhibitor. There are a few drugs named omeprazole, esomeprazole, pantoprazole. These drugs may cause osteoporosis, headache, diarrhea, um, and more such adverse effects. The next is GI protective agents. The main here is bismuth salicylate, as it may cause black stools, and also the misoprostol. It induces early labor in the pregnant women. Now we can see the answer is D. That is the most common adverse effect of omeprazole is osteoporosis and diarrhea, and not constipation. It is the another common adverse effect. Also, black stools, as we discussed before, are associated mainly with bismuth subsalicylate. Next question is, ranitidine inhibits which of the following? Gastrin binding to parietal cells, histamine binding to parietal cells, H plus, K plus ATPase, parietal cells, prostaglandin receptors. Now, here is the structure of parietal cells. It has four receptors on the wall, that is M3, H2, G receptors, and prostaglandin. The first three receptors, they induce the acidic secretion, whereas the prostaglandin helps reduce the secretion. In And therefore ranitidine, that is histamine H2 receptor antagonist, is administered to the patient, as it inhibits the histamine binding to the parietal cells, and it also reduces acidic secretion. It indirectly inhibits the synergistic acid secretion that is stimulated by gastrin binding to the parietal cell gastrin receptors. Next is, which of the following is true of cimetidine? Its options are, it is a prostaglandin analog of PGE1, it is a prodrug, it is associated with confusion and hallucinations in elderly patients, it reduces the duration of action of other drugs. Now, as we discussed before, this drug comes under the class of H2 receptor antagonist. So it it mainly causes confusion and hallucination, particularly in elderly patients, and it may also inhibit hepatic microsomal enzymes to increase the duration of action of other drugs. Thank you.